Good afternoon, and welcome to Mercy Health Muskegon's Healthcare Spotlight. This is your host, Katie. Each week, Mercy Health will bring you important and helpful information that guides you in becoming more informed and more involved in your healthcare decisions. Carefully listening to you and encouraging you to take an active role in your healthcare is just as important as having access to our specialists who use the latest technology. At Mercy Health, we offer compassionate care, award-winning expertise, and the latest in technology, all in an inclusive, faith-based setting that honors the sacredness and dignity of every person. At Mercy Health, it's not either or, it's all these and more. It's Mercy Health. Today, we're talking about a serious but very important topic, suicide prevention, with Michael Pine from Muskegon County Suicide Prevention, and Jack Kazmarek, a nurse at Mercy Health Muskegon, and also joining us is Jamie Eastway, a social work manager from Mercy Health. So let's start having this respectful conversation about this serious topic. So, Michael, let's start with you.
Okay.
What is your organization, and what is your role there?
Well, I work for HealthWest, which is the community mental health here in Muskegon County. But I have chaired the Suicide Prevention Coalition for the past, I believe it's 5 years. And I also chair, which I've recently turned over to, there's a new chair for the Suicide Prevention Coalition, but I also chair what we call the Suicide Fatality Review Team. And so those, the coalition and the Suicide Fatality Review Team are community partner coalitions and teams that come together and work. So really through my organization, HealthWest, I'm able to participate in those other things and do suicide prevention work here in the community.
And so what is the contact information of someone or their loved one if they need help?
You know, I guess, which is really important. I'm glad you bring that up. I think that here in Muskegon County, if the first thing I would tell people is there's a texting number that someone can text if they felt like they needed help and they were in a crisis at that moment, right? Mm-hmm. Or seeing something on Facebook or with friends. So I'll give out some numbers that are more sort of universal, and then I'll talk local. If someone were to be struggling, having a problem, or you had a friend with a problem, they can text 741-741. And there's an 800 phone number, which you can call and talk to somebody. 1-800-273-8255. That rings in the region here, by the way. It'll ring in Grand Rapids. It'll ring in Kalamazoo, and they're familiar with resources. Here in Muskegon County, if someone wanted some help through community mental health, and anybody can call this number, 231-720-3200, and ask for assistance.
All right, thank you for that. Michael, how did you get involved with this work?
That's a good question, too, because it felt like the former chair of the Suicide Prevention Coalition asked if I would be interested in doing that. I had started working in customer service. There's a lot of community outreach and things that we do, and I thought, well, that sounds like a challenge. I'll take that challenge on, and a bigger challenge than I thought, than I knew. Probably like many people in Muskegon County, it was a much bigger challenge than I thought. So I sort of fell into it, and that's what I'm doing still.
All right, so Michael, what are some key statistics about suicide? Are we seeing an increase in it, and what age groups?
I will say that the statistics are the tough part. The suicide rate in the entire nation has continually increased over the past 20 years, 30 years. It's increased. I've been a social worker for 33 years, and it's gone up almost every single year, certainly for the past 15 years. So in the United States, 44,000 people a year die by suicide, which is more than breast cancer. And the medical examiners will tell you, and the research will show that number is probably 5 times higher, maybe 6 times higher, because they can't call every single death a suicide. They're not sure. Single-person car crashes and drug overdoses. And that's not to say that every single-person car crash is a suicide, of course, right? So we're talking about something that is, at 44,000, that's the 10th leading cause of death in America. If you multiply that by 5, it's the 3rd leading cause of death in America. So this is a huge problem. Here in the state of Michigan, we're ranked in the middle, about 34th in terms of states. And Muskegon County has a rate that is higher than the state average and the national average. We have a higher rate here in Muskegon County, sometimes 40 to 60% higher in any given year.
And so why is that Muskegon that has a higher?
Yeah. The question is always why, right? Whether that's your family that's lost somebody to suicide or you've lost a friend or a loved one, the question is always why. And that's true of the community too. And I'm sure Mercy, whenever this happens, the question is always why. And it is a very, very complex situation. It's never as simple as just bullying, for example. It's never as simple as the foreclosed house or divorce. Usually there's a lot of factors that go into suicide, including mental health concerns, of course. But here in Muskegon County, we've also recently done an adverse childhood experience study, ACEs. MuskegonACEs.org is a website. And what we do know from adverse childhood experiences or traumatic events in people's lives, those people who have experienced more traumas have poorer health outcomes. And that includes mental health and suicide. The survey results, Muskegon County has poor health outcomes in general, which lots of community partners are coming together to work on and are doing wonderful work, actually. What we've learned from trauma studies is that there's a lot of trauma in the community and there's poor health outcomes that are directly related to trauma, and that includes also suicide. And then when you get into the bigger pictures of why in our society, in our country, that suicide is increasing, there is a conversation we could go for a very, very long time. There's a lot of factors. The risk is trying to say, oh, it's bullying, oh, it's this, oh, it's that. And that dismisses the bigger conversation of mental health concerns and physical health concerns and chronic pain concerns and opiate addiction, et cetera. It's just very complex.
Yes, it definitely is. And so how was the work of the coalition? How is that helping deal with some of these things? You said that they implemented the study. Did they lead the study or did they?
Actually, that study was conducted through a lot of community partners and health providers. It was a joint effort in the community here.
Very cool.
But the coalition, the Suicide Prevention Coalition, when I took over it, I learned suicide prevention coalitions are data-driven, and we didn't have data. I knew then that there were child mortality, child death review teams that are legislated, and there was also since the 1970s, there's also review of domestic violence deaths. That's backed by legislation since the 1970s. And I thought, well, let's start a fatality review team around suicide. And we did that. And Jamie joined us on that from Mercy, and we have law enforcement in the ISD. We come together with a medical examiner, public health, and we review every death by suicide in as much detail as we can without legislation supporting us, right? We have to still abide by confidentiality, but there's quite a bit that we've gleaned, and we have much more data than most other counties. And so that data has helped us to focus on, what do we need to do where, what age groups are being impacted, et cetera, and to focus programming. We're kind of early on yet, and I will say that with all the innovative work that we do here in the county with the adverse childhood experience studies and the fatality review team around suicide and all of this, we haven't had an impact on suicide that we can see. But I think it's going to be a slow process over several years. And I think together with the community partners coming to the table the way that they are now, and with the innovative work that we're doing with suicide prevention and trauma-informed care and the fatality review teams, I think we're going to get some traction.
Okay. And Michael, what is that number again if people wanted to text or call?
If someone were struggling with thoughts of suicide or even depression, you can call 1-800-273-8255. The texting number for people I'm less young than most people. So some people are much more inclined to text, and the number is 741-741. And the busiest time of day for that phone number is lunchtime. So you know it's young people that are texting.
Wow. And that is very sad. So Jack, let's ask you a couple questions here. So here at Mercy Health, what kind of connected the dots to have healthcare as a critical partner in this work? I know we mentioned that Jamie was sitting on one of the councils as far as the research goes, but how is Mercy Health fit in with all this?
Well, for my part, doing work for a BSN program through Loyola University, I was doing a community health assessment and kind of stumbled across the data that Mike's been talking about. And part of that data says that people who have committed suicide do come to hospitals, they come to primary care provider offices. And it made sense to me that we should be doing more on our part. We don't really have a training component for RNs and maybe nursing assistants who come into the hospital to adequately deal with a situation like that. We oftentimes, when we come across a suicidal person, we get a little verklempt, we get a little scared. We don't really know what to say. So I thought it'd be a great idea through the unit-based council of the third floor. I'm the chair of that, to bring Michael in. And I knew he was an awesome speaker because I had interviewed him for that class for my BSN. And it's kind of led to being on the radio show now. So I'm kind of glad we did that.
Very cool.
Thanks, Mike.
And so,
You are welcome.
Yeah.
So, Jamie, how is Mercy Health? I mean, how are they working on suicide rates and awareness? What are we doing for that?
Well, one of the things we're doing is sitting on the suicide death review team. And with the data that Michael's been able to collect, that has allowed us to provide more awareness for the primary care physicians, for the ER physicians. With that data, now we're getting some engagement, and we have an ER physician that it's Tammy Privatis, Dr. Tammy Privatis, who is interested in sitting on that team. And also we have a primary care physician now who is engaged, Dr. DeAndrea Harris, who is interested in participating in this.
And Jack had mentioned that a lot of people before they commit suicide or take their own lives, that they will see a healthcare provider before. So, I mean, so is that what we can kind of help as healthcare providers, kind of knowing some of the signs, the symptoms that, depression and other things? So what is the role of the healthcare provider essentially, in preventing suicides?
Sure. I think they have a significant role. Sometimes the physician is the only person they trust to tell. Sometimes a healthcare provider is the only person who asks. And I think we are asking more of those questions than we've ever asked before. We're asking patients when they come to the emergency room for an earache. Are you ever having thoughts of hurting yourself? Are you not wanting to wake up in the morning? And we're asking some of those questions in the primary care offices as well.
Okay. And then what are you finding when you start asking those questions? What are patients telling us? Are you seeing that it's more of?
Is there an impact?
Yeah. Is there an impact? Are people replying to that? I mean, have you heard of anything, Michael? Or
I can tell you this, and I don't know if there's a direct connection to the fact that Mercy and Jamie's at the table for that fatality review team, but we've been invited to go into doctors' offices to teach a QPR class, which is question, persuade, refer, which teaches the skills of what to say and do with somebody who's suicidal, whereas prior to the fatality, maybe this is anecdotal, I don't know, Jamie, but prior to a lot of this information and data getting out there, we weren't hearing from doctors' offices, for example, to come in and teach staff. And that means people who are answering the phone to physicians. And I think that probably is a direct result, too. Impact on individuals who are coming in, I don't know that we are going to know that for a little while yet, but the hospital may know better than I would know, too.
Yeah, and Jackie brought up that you had Michael come in and present to Mercy Health, some colleagues. So what was the feedback? What was the purpose of that event? And what was some feedback from the colleagues at Mercy Health?
Well, to go over the data, number one, is to raise awareness that Muskegon does have a higher rate. Two, to kind of broach the subject about doing something, bringing in a program, let's say, or maybe just having some trainings, things like that. I wanted to get some movement happening. The reaction that I got mostly was that we were looking to have some practical things to say to a patient that was exhibiting these signs. Knowing about the data got a lot of people more interested in learning about things like that, having a training at the hospital. So that way, when you come across somebody that is exhibiting those signs, you know what to say. You're not just fumbling to try to cobble together some words and maybe hopefully say the right thing. You have actually some evidence-based practice to back that up.
That's great. And Michael, you had mentioned a QPR class. Is that only for healthcare professionals,
No,
or is that?
No. As a matter of fact, there's a few different trainings that are out there. Right now we're doing in Muskegon County QPR, and we've trained 23 people to be instructors in QPR. And in just over a year and a half, we've trained nearly 2,000 people so far. But that's community members and that's professionals, and we're training all of our staff at HealthWest. QPR is an evidence-based program. The more people who know it in a community, the fewer suicides in that community. So we're working hard on that one. But really, when we're talking about, especially with healthcare providers, historically, and in my 33 years, there was a divide between the mental health providers and the physical health providers. And I think we're all coming to realize, of course, that this is a whole person, and brain illness, mental illness is still a physical problem. And I think we're just seeing a shift in, okay, how do we all fit in here to really take care of this person regardless of what that diagnosis may be? And usually there's a physical health component, or many times, of course, there can be a physical health component as well as a mental health component. And I think that we're just starting to see a shift now where the medical community gets involved more so than ever before and saves lives.
Great. And to that point, Jack, do you believe that we will be inviting Michael and his colleagues back to Mercy Health and to do more training sessions?
Bigger brains, hopefully.
I would like that. I think that would be a great set moving forward.
Yeah. There's some plans in the offing here to bring educators in, other programs that are evidence-based, and I think we're turning a corner.
Yeah, great. This is something I would kind of like to mention. It's suicide. You have to talk about this with pop culture, high-profile celebrity deaths. Social media. There's just lots of issues that play into suicide prevention or suicide. This term suicide ideation, and what has gotten some recent buzz lately has been the show on Netflix talking about a teen committing suicide.
Right.
A lot of people talked about that, a lot of news coverage about it. Netflix probably really liked it because everyone was giving lots of buzz about their show. So, Michael, what are the implications of when something like this is popular? Does it help to bring awareness about suicide, or is it, in fact, does it hurt those who are suffering? I think
this particular show, it's probably both. It's broad awareness. There's no question about that. And I think it will also lead to more deaths by suicide. And I think partially it's because, right away you wanted to talk about what are some resources for people who may be struggling. And I think that particular show didn't offer resources or warning signs or anything. It was just this show. And the risk, of course, is that it would glorify a death by suicide. But I tell people it's in the culture. A lot of people die by suicide. Many people have been touched by it. If you've lost somebody in your family to homicide, you probably don't like television at all. I mean, everything is homicide related, right? And it's traumatizing.
Yes.
And many people in our society, sadly die by suicide, and it's finding its way into the culture. And that particular story is based on a book that has been in junior high schools for many, many years. And it's not mature 17 rated. It's a much different version, but that story has been around for quite some time. I think the handling was poor, the execution was poor, and I think the risks are unfortunate. But I think as parents or people who are out there, it's an opportunity to have that discussion with your young person about suicide. And it's a topic most of us don't want to talk about, but it's an opportunity. So there's good and there's bad.
And there's so much as a parent. There's so much things you have to watch out for. When you mentioned, this is kind of targeted toward young people, it takes place in high school. What are some things? What are some statistics about youth and suicide rates?
There's a. I'm the suicide guy. There's hope, right?
Yes, I know. That's what I'm saying.
But I know that this has also touched many families too. The statistics are very uncomfortable in that 15 to 24-year-olds, it's the second leading cause of death. Young Latinas, young Hispanic females, it's the number one leading cause of death. The Center for Disease Control, November 4th, 2016, just this past November 4th, announced that it's the number one leading cause of death for 10 to 14-year-olds. We're talking middle schoolers here, okay? That's tied for car crashes. Now, I don't want families to be fearful or to live in fear or not want to send their child to school or, now they've been bullied and oh no, but at the same time, this is in our culture and we have to kind of figure out all of the reasons why, what it means and what we have to do to reverse these trends.
Would you recommend the QPR training just for parents out in the community? Everybody?
Absolutely, everybody. And the one bit of advice I would give to young people and to parents to tell their young people is, this is a secret we do not keep. If a friend is talking this way or there's a Facebook post, we don't keep that secret. And I've met many traumatized children who've lost a friend to suicide who they were told and they kept a secret. And maybe they didn't know. It's not as if I feel that they're responsible, of course, but young people are secret keepers, more so than adults even. And the one bit of advice I would give to parents and young people would be, don't keep this secret.
That's great advice. So Jamie, did you want to add something to this?
And I think to piggyback on that, parents should not be afraid to talk to their kids. Ask them directly if they're having any thoughts of hurting themselves.
Yeah, that's good. That's very good advice. So anything else we want to mention about for the youth, kind of the next generation, trying to help get them
I will say there's another training called Mental Health First Aid. We've done that for several years here in Muskegon County, 3 or 4 years now, and there's a youth version. And this really helps people who work with youth. We teach it to young people as well, which is always kind of interesting, right? Because adolescence is a very difficult time. Anyway, your brain's developing until you're 26 years old. It already is a rocky time. And it helps parents to learn how to tease out, what might be normal adolescent development versus what is a mental health concern. And so mental health first aid, and I would steer people towards HealthWest. At this point, I don't believe we have anything in the calendar, but in July we most certainly will. So I would go to healthwest.net to look for these classes, QPR classes. We'll come to you with QPR too. If you've got a group of 10 people or more, we'll come to you. Give us, shoot us an email, contact us through the website. Or you can go to HealthWest Facebook page, and we have these classes too. So that would be something I would add for parents, and especially towards young people.
That's great. Like church groups could host these, and oh wow,
we'll go anywhere.
We'll go anywhere. All right, you heard him here. He'll go anywhere. So Michael, too, one of the things are there any taboos, anything that we just when you work out in the community, anything that you try to educate people about with when talking about suicide prevention?
People have a fear that if you talk about suicide, people are going to die by suicide. And quite honestly, that is not accurate. If you're talking to somebody one-on-one and you're trying to help that individual and you ask that individual, are you thinking about taking your life? Are you thinking about suicide? You're not planting that seed in their head, right?
Okay.
We fear that, and I understand that fear, right? We do this as human beings. It's kind of a bizarre thought because if your friend is depressed or your family member is down and they're not feeling well, and you go to them and say, hey, are you thinking about taking your own life? They're not going to go, wow, thank you, I've not thought of that, and then go do that. But we fear it, but it's a totally irrational thing to think. Mm-hmm. At the same time, here we sit on the radio talking about suicide. Now the risk is increased. If you're on social media where you're broadcasting something, or we're on the radio now and we weren't talking about resources and phone numbers, then the risk increases. And this is proven through the Center for Disease Control's Center for Disease Control research, right? Give resource. If you see a post on Facebook and somebody's talking about suicide, even positive things that occur in research and positive things that are happening, post the phone number. Post the texting number, 741-741. put it in there and just say if you're struggling or you're having a problem, and the likelihood is that you're going to actually help somebody. So broadcasting, be cautious. Give resources. Give information. One-on-one, you're not planting the seed in anybody's head.
Awesome. That's very good advice. And so that texting number again is, Michael, is
741-741.
Awesome. And so, Jamie, what are some next steps that Mercy Health will be taking as part of this coalition, this process here?
Continuing to participate with our community partners like HealthWest, and to be participating on the Death Review Committee. But also, I think bringing Michael out to Mercy Health was really an eye-opener to find out that our nurses are uncomfortable with this topic. Wow. Mm-hmm. So it gives us an opportunity to look at ways to educate all of our staff, not just our social workers who are comfortable, talking about suicide, but also our nurses and our physicians and any of our staff.
Wonderful. And you'd said that, often we're the trusted resource for people. And so if we don't feel comfortable asking those questions, then that, could be a barrier for folks.
Exactly.
So, all right. So let's see. Are there any final takeaways for the audience that we'd like to leave everyone with? Jack, do you have a final takeaway that you'd like for people to know about Mercy Health's work?
Just that we're continuous learners. That's one of the foundations that Mercy kind of operates under, and identifying these problems, within the system, and working on that. That's really important to us. And moving forward, we would like as much as possible to help with that, and to reach out more, and to become better educated. So
very cool. Yeah, and Jamie, you had said that we're continuing the education, the resources for all staff members, and so forth. Anything else you'd like to add to that?
I guess I would just want to end by saying if you or a family member are feeling unsafe and you can't maintain your safety, please text the number that was given or utilize the emergency rooms.
Very good, yes. And so, Michael, some final takeaways for the audience?
I think with everything that we've talked about so far, I think I would say to those individuals who have lost somebody to suicide, because we know that that's a large number of people as well, that loved one or that friend that you've lost to suicide didn't do that to traumatize you and to make your life, upside down. And that those people who have survived suicide, meaning that they've lost somebody to suicide, I would just encourage them to stay strong. And we know it isn't easy. And as we talk about these topics, we keep in mind those individuals that we've lost. And we know that there's families out there that are struggling and that this isn't an easy experience. And that trauma, too, we also want to work with as well. And if somebody feels like they need assistance or help, to come to HealthWest, come to the emergency room if you need to. And that we're not forgetting about those individuals either, the people who are left behind.
And that phone number, the text number again is 741-741.
741-741. The crisis line is 1-800-273-8255. A real human being is going to talk to you, and they can help. Your personal care physician is going to be helpful in this community. I know more and more and more. They're educated. Certainly the emergency room is there if you really need to talk to somebody.
Very good. All right. Well, thank you all for joining us on this conversation. This can be a hard to talk about topic, so I appreciate the audience for listening and for taking in this information. So today's broadcast has been brought to you by Mercy Health Muskegon. At Mercy Health, we offer compassionate care, award-winning expertise, and the latest in technology, all in an inclusive, faith-based setting that honors the dignity of every person. At Mercy Health, it's not either or, it's all of these and more. It's Mercy Health.